Like and subscribe and click the bell icon to get new video updates.
What is behind North Korea's admission of a COVID-19 outbreak? North Korea spent 2.5 years rejecting outside offers of vaccines and steadfastly claiming that its superior socialist system was protecting its 26 million people from a malicious virus that had killed millions around the world. So the surprise admission this week of domestic COVID-19 cases has left many outsiders wondering just how bad things really are. And there is rising worry that it could cause a major humanitarian crisis in a country with one of the world's worst public medical infrastructures. Because the North has been shut up tight since early 2020, with no reporters, aid workers or diplomats regularly going in, reading the situation is something of a guessing game. The North has been vague with its state media descriptions of widespread fevers. But there are some worrying facts: no reported vaccines, very limited testing capability, a terrible medical system and widespread poverty. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. Without immediate outside aid shipments, some experts say North Korea could face massive fatality and infection rates. Others, however, say North Korea is using its admission of an outbreak to rally the public against the virus and boost its control of its people. Here is a look at what a lockdown in one of the world's most locked down nations might look like. What is known about the outbreak? North Korea announced on Thursday that an unspecified number of people in Pyongyang tested positive for the Omicron variant. It called the outbreak the state's most serious emergency. It was unclear, however, about the extent, and the North's media used vague language. State media reports on Friday said a fever has been spreading explosively since late April, leaving 6 dead, 350,000 sickened and 187,800 quarantined. They said one of the dead had been diagnosed with the Omicron variant. Then on Saturday, North Korea reported 21 new deaths and 174,440 more people with fever symptoms. As of Sunday, North Korea has reported a total of 42 deaths and 820,620 suspected cases, with 324,550 people under medical care. Kim Sin-gon, a professor at Seoul's Korea University College of Medicine, said most of the people with fever were likely virus patients. He said North Korea has a limited number of COVID-19 testing kits. The World Health Organization says North Korea has reported tests of 64,200 people since the pandemic's start, an extremely low figure compared with other countries. The number of COVID-19 tests in South Korea stands at about 172 million. North Korea's outbreak may be linked to a massive military parade on April 25, where leader Kim Jong-un spoke about his nuclear weapons in front of tens of thousands of Pyongyang residents and troops. The Omicron virus may have entered North Korea over its northern border with China when it reopened railroad freight traffic between the two countries in January. The border has since been closed. What are the challenges? The outbreak could be devastating because North Korea's people largely remain unvaccinated and it suffers a chronic shortage of medicine and medical equipment. North Korea has many vulnerable people who don't have strong immune systems. Its official inoculation rate is 0 and it has no COVID-19 treatment pills, Professor Kim said. North Korea may end up with the pandemic's worst death and infection rates in the world for its population size without outside support, he added. In many advanced countries, Omicron has led to significantly fewer hospitalizations and deaths than previous coronavirus variants. But that is mostly because of vaccinations, use of COVID-19 antiviral pills, effective treatment at intensive care units, and populations that have been exposed to the virus before. Read more. None of this applies to North Korea, said Young Jae-hun, a professor of preventive medicine at South Korea's Gashon University. We were talking about a 0.1% fatality rate for Omicron in South Korea, but that is going to be significantly higher in North Korea, possibly even reaching 1%, Although it is difficult to make accurate predictions at this point, Professor Jung said, North Korea's secretive nature makes it virtually impossible to figure out the true scale of its outbreak and how it will develop. Many North Koreans have adjusted to living with a troubled medical system and buying medicine privately, according to Ahn Kyung-soo, head of DPRKHEALTH.org, a website focusing on health issues in North Korea. While North Korea cannot avoid mass infections, Mr. Ahn said it will likely avoid a catastrophic death toll like the hundreds of thousands of deaths reported during a mid-1990s famine. Read more about the spread of COVID-19. How is North Korea responding? North Korea has imposed a nationwide lockdown since Thursday.